Thanks for joining us again on ESCMID TV. With us now in studio, Daniel Diekema, who's traveled in from the US, presented a fascinating paper in the cardio session at Congress on the last day of Congress in Vienna, all about a mycobacterial infection within heater-cooler units during cardiac surgery. And Daniel, lovely to have you with us. Your paper was entitled "The Outbreak of this particular problem." I mean, is it really an outbreak?
Yes, it is. It's a particular species of Mycobacterium called Mycobacterium Chimera, and it is now affecting over 100 patients in at least 10 different countries, multiple states in the United States, and it appears to be caused by the aerosolization of this strain of organism inside an operating room from a heater-cooler device.
From a specifically manufactured heater-cooler device?
Yes, the cases to this point of this particular strain of Mycobacterium chimera are all from a single model of heater-cooler device. And when the organisms have been analyzed in the laboratory, they are very, very similar to one another, suggesting that they all came from the same source.
Why then, I mean, even as the CDC has issued a paper on this as well, why then has that particular machine not been recalled?
Well, that particular machine, it's very popular as a heater-cooler device. It's used, I think it has 60 to 80% of the global market, and it is actually impossible to remove it from every operating room without halting life-saving surgical procedures.
And hundreds of thousands of these procedures take place.
Yes, exactly. So in the interim between a redesign of the heater-cooler device, we need to take some steps to try to reduce or eliminate the risk to patients.
What happens within the bacterial infection? How does it present itself?
Well, there's two basic types. One, it can cause a wound infection or an infection in the chest that can be cured with antibiotics and surgical intervention. The other type of infection, which is much more difficult, is an infection of a device like a heart valve, a vascular graft, or a left ventricular assist device. Once this organism clings onto a device like that, it stays in your system, continues to spread throughout the body, and it's very difficult to eradicate.
And this could be even years beyond the surgery in its own regard. How long does it go back in terms of what you've discovered so far, sir?
Yeah, so that's one of the problems. Many of these patients feel very well for up to 1 to 2 years, in some cases even longer, before they begin to develop symptoms of weight loss and fever. So there's a very long time to the onset of symptoms. And what's happening in all likelihood is that the organism is multiplying in the person without causing any symptoms until it reaches a certain level, and then it begins to cause illness.
How do we solve the problem, sir?
Well, in the near term, the best we can do is to do everything possible to separate the heater-cooler device exhaust air from the air of the operating room. And various different approaches have been taken to encase the heater-cooler device and funnel the exhaust out of the operating room, to remove the heater-cooler device from the operating room by sort of drilling a hole through a wall and operating it outside. And there are some other approaches as well, but the long-term solution is to redesign these devices so that there is no risk at all of what we call a bioaerosol being produced in an operating room.
Brilliant. Well, thank you for raising the issue here at Congress. Yeah. Fascinating paper. And we appreciate you coming into the studio to share that with us.
It was a pleasure to be here.
Thank you, sir. Appreciate it.
Thank you.